Welcome to the Global Child Dental Fund and the World Federation of Public Health Associations All Health Group seminar. I'm Professor Raman Bedi. I'm an emeritus professor at King's College London and chair of both the Global Child Dental Fund and the WFPA All Health Group. I'm pleased today to have Professor Rick Needleman, who's the professor and chair of the Department of Epidemiology and Health Promotion and the co-director of a WHO collaborating center at the College of Dentistry, New York University. Rick, welcome.
Thank you, Raman.
Rick, it would be really helpful in our consideration of this pandemic and urgent dental care. And today we're particularly looking at the role of silver diamine fluoride. I wonder whether you could just highlight your experience with SDF and then the current protocols that are being undertaken in New York and the United States.
Certainly. So we advocate for what we're calling safe dentistry, safe aerosol-free emergency dentistry across the lifespan during this period. So in terms of silver diamine fluoride, from the time children have teeth till the elderly are beginning to lose teeth, we're using silver diamine fluoride to treat acute problems from coronal caries to root caries in acute situations. It arrests caries and it reduces pain and prevents caries. So it has three different functions.
So, Rick, the situation we have in Europe and in most parts of the world is that we are no longer undertaking routine dentistry anywhere, and patients are being triaged, which we all agree with. The 3 A's, advice to antimicrobials to analgesics. But there's always a situations where patients actually have persistent problems and need a face-to-face encounter. So we in UK and Europe are undertaking that in what we call urgent dental centers. Those centers are specially equipped. They have personal protection for their staff and patients are triaged. In that situation, where would you see, can you give us some examples of where SDF could particularly be of value?
So SDF is a simple, clear fluid that can be applied by almost any trained individual. And we're in our school program, for example, we have nurses, school nurses applying silver diamine fluoride to school-age children. And that can be applicable in an elder care. It can be applicable in an urgent situation in an emergency department. It could be applicable in a dental practice seeing emergencies. So I think, again, across the healthcare spectrum and the life spectrum, it's easily applicable and it's safe. Using typical PPE. You don't need a hazmat suit in a positive pressure environment. There's no aerosol involved. So I think it's safe both for the patient and the clinician.
But particularly one of the focuses is that patients may turn up with a particular problem, a single tooth or some bleeding, but often clinicians see other cavities. Do you see a role for SDF to, in a preventive way, so that it can arrest decay in the other cavities until situation returns to normal?
Yes, absolutely. That's what I tried to indicate when I said we advocate for safe dentistry. Aerosol-free dentistry, a centerpiece is silver diamine fluoride. So it prevents decay as well as arrests decay, as well as reduces sensitivity. So it's a triple threat, if you will. So if somebody comes in with root caries and acute pain, why wouldn't I take another 30 seconds, 60 seconds to, let's say it's a child, instead of doing sealants, putting silver diamine fluoride on pits and fissures to prevent the potential of subsequent decay. We're talking about safe, aerosol-free emergency dental care. We're trying to lay a foundation to prevent people from showing up in the OR. So yes, It's a short answer to your question.
It is, and that's so. I think, in summary, for me, is that whatever the reason why a face-to-face encounter is needed, whether it's bleeding or an abscess, usually there is visibly in the other teeth that might be affected that are symptomless now, and the easy application of silver diamine fluoride on a microbrush could actually prevent future problems. And I think that's a message that is probably not being missed at the moment in our urgent dental care centers.
Well, I can't speak for yours, that I can speak for ours, that when people have done surveys of clinicians and their knowledge about SDF, they seem to be more worried, not seem to be, they are more worried about black staining than they are about clinical benefits. So we're talking about safety of the patient and the clinician. We're talking about efficacy in caries arrest and prevention. And in an emergency situation, this is, to me, an absolutely essential element.
So, Rick, there's a lot of discussion in society that it won't be going back to normal afterwards. So, you know, lots of things are changing in society, and that will remain changed. When we go back into dentistry, do you think the experiences we're tackling now with in this pandemic will change dentistry in a different way? Do you think we'll be more preventive orientated, or do you think it will be going back to business as normal?
Yeah, if I could predict the future, that would be great. For us, we think we need a foundation which is aerosol free, and as we move forward, we can figure out what's safe in terms of aerosols. So I think we're going to start monitoring our environment a lot more if we move back to aerosol using equipment. So I think we're going to be in this warm zone. If we're in the hot zone now in the midst of the COVID-19, we're going to be in the warm zone for a long time while we figure out all the other safety precautions. So I'd say for the intermediate term, whether that's 6 months or 6 years till we figure everything out, we're going to continue to do aerosol-free dentistry, and it is going to be a foundation for clinical practice. It has to be, because we can't afford the risk that we're going through now without monitoring our environments to know how to do that.
Professor Rick Needleman, thank you so much for your time, and thank you for enlightening actually us on silver diamine fluoride and also the potential future shape of dentistry. Thank you.
My pleasure.